Dehydration, constipation. Just so we make sure that we understand what we're talking about here, who would like to tell us what constipation is? Doctor Irene?
That means if I go once a month, I'm not constipated, right?
Yeah, that's what it means, right, doctor?
Oh no. Constipation is when you cannot have regular elimination of your stools.
So then, just because, we're diving into this particular topic, what is everybody is different, but what would be a understanding of what regular would mean?
Well, I would hope that that regular, for everybody would mean at least daily stools, that it needs to be soft. It should not be hard. It should be a mush kind of consistency and not, people think that, oh, if it's mushy, then I'm having diarrhea. No, that's actually not true. If it's formed like a log, that's actually hard. And so it needs to be more of a mushy kind of consistency.
All right. So now that go ahead, Ari.
So I had the concept that you should have a bowel movement after every time you eat within 30 to 45 minutes, as long as you're eating like just regular 2 to 3 meals a day. I don't know that that's would work if you're doing the 6 meals a day.
All right.
Yeah, so that's why I said at least one. And then it all depends on what you're eating. So you did kind of, say, if as long as you're eating, good, healthy foods, if you're eating very simple, foods like how we're supposed to be eating, then yes, you would be eliminated because those foods go through your system, faster. And people ask, what's the whole issue about constipation? Is it just that I have to sit on the toilet and I have to push and I have pain, that kind of stuff? Well, no, not really, because, the transit time for your food to go through your system, if it stays in there for a long period of time, it's depending on what you eat, especially those factors can actually lead to colon cancer, because the food just doesn't eliminate fast enough and all those toxins get absorbed back into your body.
Okay, so now that we have kind of a thorough understanding of what constipation is, before this video, we had kind of a conversation. Does dehydration cause constipation, or does constipation cause dehydration? Who would like to take that up?
The answer is yes. The answer is yes.
The answer is yes. Okay. Doctor, how would you respond?
Yes, I agree. Most of the time, the dehydration would probably be the causative factor. So it's always the chicken versus the egg thing, right? But most of the time, the dehydration then causes constipation because you don't have enough fluid to move your stools along. But if you get backed up enough, if your constipation is so severe that stool starts to back up in your colon and then into your intestines, you can actually, not feel like, drinking or eating anymore. And anything that you actually do take in by mouth will just come right back out.
So that's a severe constipation. So then if I make sure, I know we've talked about this in multiple other videos, but if I keep myself hydrated, then there is a less of a possibility of getting constipation.
Oh, I was just going to say that I don't know if it's too much information, but for me, personally, it's usually when I do get dehydrated that's when I suffer from constipation. Usually it's not an issue.
So then just to really make it clear, constipation only comes from dehydration.
No. Well, yes and no. And so there are certain foods that we can eat that will cause more constipation, such as animal products, because it increases your transit time through your colon. But I think part of that also kind of comes to dehydration because those products require a lot of, the body putting out its own water. And so it actually will dehydrate you. And so, yes, I think the answer is a more resounding yes than a no.
Interesting. I wasn't expecting that answer. I do understand the importance of hydration and process within the process, but yeah, it's absolutely correct. If I eat cheese and whatnot, and if that's what I'm feeding into my body, and I live off of cheese, my body is not going to respond the same as if I am eating fruits and vegetables and drinking water. Is this a correct statement?
Yeah.
Okay. And from a massage therapy standpoint, if somebody is coming in that condition, do you have a recommendation of how you can help as a massage therapist?
Well, there are stomach massages that would help to, and pressure points that would help to initiate getting that moving again, besides drink your water. Yeah, drink your water, soak in a tub at the same time, making sure you have some balance there in the electrolyte areas will also help.
Okay, so we've been looking at dehydration and constipation. Is there any other thing that either of you would like to? Yes.
Sorry, this might actually help to make a little bit more sense. And so if you look at the function of the colon, the function is for the colon to reabsorb as much water from your stool because your body wants to maintain a good water, volume. And so if you are already decreased in water, your colon is going to grab as much water out of your stool as it can, which then leaves that stool that's in your colon even harder and more solid. And so it makes it a lot more difficult to pass it through. So if your body already has enough water, your colon doesn't have to resorb as much water from your stool, and it can pass through a lot easier. So hopefully that kind of gives some clarity as to why being dehydrated causes constipation.
Okay, thank you for that. Anyone else have any other thoughts to bring forward? All right, so this is our information related to dehydration, constipation. Our next video will be dealing with a dehydration chest pain. But as it relates to this content of dehydration, constipation, we hope we have been able to be informative for you.